Entirely different, but of a national importance. The World Health Organization has confirmed that Kenya, Uganda and Rwanda are facing a potentially highly transmissible type of the Mpox virus, dubbed Mpox clade 18 or 1B, I beg your pardon. Elizabeth Otieno reports on this story, which tells us how the World Health Organization has announced that it will convene an emergency committee meeting to assess whether the increasing spread of Mpox in Africa warrants a global emergency declaration.
Since the beginning of this year, the Democratic Republic of Congo has been experiencing a severe outbreak of Mpox, with more than 14,000 reported cases and 511 deaths. The disease later escalated to other countries in East Africa, including Kenya, Uganda and Rwanda.
About 50 confirmed and more suspected cases have been reported in 4 countries neighboring the DRC that have not reported before: Burundi, Kenya, Rwanda and Uganda.
Mpox outbreaks are caused by different viruses called clades. The World Health Organization says the current Mpox virus in East Africa is from a dangerous type of clade.
The current outbreak in the eastern DRC is caused by a new offshoot of clade 1 called clade 1B, which causes more severe disease than clade 2. We have released $1 million from the W.H.O contingency fund for emergencies to support scale-up of the response, and we plan to release more in the coming days.
The emergency use listing for 2 Mpox vaccines has been launched. The vaccine manufacturers and applicants are required to submit applications for evaluation. The team will review these applications and assess them within a month. The technical advisory group shall then be convened to make the necessary recommendations.
2 countries in the African region have already approved Mpox vaccines for emergency use. That is, Nigeria has approved the use of one vaccine, BAMBA, and the Democratic Republic of the Congo has approved the emergency use of LC16 vaccine and BAMBA.
Soon, an emergency committee meeting will be convened by the World Health Organization to assess whether the Mpox outbreak warrants to be declared a public health emergency of international concern.
The committee will meet as soon as possible and will be made up of independent experts from a range of relevant disciplines from around the world.
It is relatively straightforward to stop a disease, even if it is spread internationally, if you know where the disease is, if you're able to detect it, if you're able to find cases, find contacts.
And we know that there are multiple modes of transmission. We see transmission between family members. We do see some zoonotic transmission, but we also see sexual transmission in sexual networks.
Kenya first detected an Mpox case on the 29th of July 2024 from a truck driver at Taita Taveta one-stop border point. On Tuesday this week, the Ministry of Health announced that the patient has since been healed. The World Health Organization has reiterated the need for countries to strengthen surveillance to curb the spread of the virus. Elizabeth Otieno, TV 47.